Hello friends, I hope you are all fine and doing well. Today in this video we are going to discuss some more MCQs, so please stay with me. Thank you. Our first MCQ of this video is concomitant administration of Clopidogrel with omeprazole will result in options are there: increased activity of Clopidogrel, decreased activity of Clopidogrel, no change of activity of Clopidogrel, decreased activity of omeprazole, and last option, increased activity of omeprazole. So actually in this MCQs we are asked about the effect that will occur when we co-administer these two drugs, Clopidogrel and omeprazole. So actually in the background we have to know this one fact, that omeprazole is a cytochrome P450 inducer. It will actually activate those enzymes. So when those enzymes are activated, they will quickly metabolize Clopidogrel into its inactive metabolites. So when Clopidogrel is metabolized quickly, so in our system the active Clopidogrel will no more remain, and thus its activity will decrease. So the correct option in this is decreased activity of Clopidogrel. Now moving on to the second MCQ. If the half-life of a drug is 8 hours, then in how much time this drug is expected to reach its steady state plasma concentration? Options are there: 12 hours, 18 hours, 26 hours, 32 hours, 48 hours. Now actually we know that for a drug to reach its steady state plasma concentration, it will require at least 4 to 5 half-lives. So if its half-life is 8 hours, so 4 half-lives will amount to 8 multiplied by 4, so that is 32. So the correct answer here is 32 hours. After 32 hours, a drug with 8 hours half-life, it will reach its steady state plasma concentration. So this is the correct answer. Now moving on to the third MCQ. The only immunoglobulin that can cross the placenta and thus its presence in the fetus is indicative of immunity and not of infection by some pathogen is. Options are immunoglobulin A, immunoglobulin E, immunoglobulin G, immunoglobulin M, or gamma globulin. Actually in this MCQ we are asked to identify the immunoglobulin that can cross the placenta, and that is C, immunoglobulin G. Actually immunoglobulin G can cross the placenta, so C is the correct answer here. Now moving on to the fourth MCQ. All of the following are antitussives except. Antitussives are actually cough suppressants, actually dry cough. Now options are there: levopropoxyphene, clofidinol, dextropropoxyphene, dextromethorphan, and oxylardine. So these are options, and we have to identify the antitussives. Actually in this 4 options are antitussives while one is not. The one that is not is actually this one, C, dextropropoxyphene. This compound is actually analgesic and it is not antitussive. The other 4 are antitussives. So the correct answer is C. Now the fifth MCQ of this video. The response time of ligand-gated ion channels is. Actually this is a type of ion channel that is present in the surface of a cell. So their response time we have to identify among the following options: few milliseconds, seconds to minutes, minutes to hours, hours to days, and days to weeks. So actually the correct answer is actually ligand gated ion channels are quick acting ion channels. So their response time is actually few milliseconds. Within few milliseconds these channels respond to the stimuli. Yes. Now the sixth MCQ, the response time of G protein coupled receptors is, again options are there, and the correct option is seconds to minutes. Now the seventh MCQ, the response time of enzyme linked receptors is, this is actually a type of receptor in which an enzyme will bind to it, and then this receptor will perform its function ahead. So the correct option in this is minutes to hours. Now the eighth MCQ, the response time of intracellular receptors is, again options are there, and the correct answer is hours to days. These are intracellular receptors. These receptors are present inside the cell, and most of the receptors for androgens and other steroid compounds, they lie inside the cell, and for them to respond they will take from hours to days. So D is the correct answer in this MCQ. Now moving on to the second last MCQ of this video, the family of receptors that undergoes autophosphorylation upon activation by a ligand is, so these options are there: intracellular receptors, enzyme linked receptors, G protein coupled receptors, ligand gated ion channels, autonomic nervous system receptors. This is actually a pharmacology question, and the chapter of receptors this MCQ is based upon. So in this MCQ, the correct answer is, the family of receptors that undergo autophosphorylation upon activation by a ligand is enzyme linked receptors. So B is the correct option here. Now the last MCQ of this video, one of the following is banned in the coating of pharmaceuticals in pharma industries for its health concern. So these options are there. These are actually coating materials: isopropyl alcohol, or IPA to be in short, castor oil, eudraget, methylene chloride, and titanium dioxide. So we have to identify the option that is actually its use is restricted nowadays due to its health concern. So actually the correct answer in this is methylene chloride. This is actually for the reason one possible reason is that it is carcinogenic. Another is that it may cause heart attack or asphyxiations, that is breathing problems. So for these and other reasons its use is being limited in the pharma industries for coating purposes, but still this compound is used in many industries in Pakistan, but it is not recommended to be used for its health concern. So D is the correct option here. So friends, this was all for now. Thanks for watching.